good news is there are proven ways to bring blood pressure down naturally. And here's an interesting one: pet ownership. Just the name itself brings smile on many people's face. Studies have shown that people who own pets, especially dogs, tend to have lower blood pressure. In one small study, adopting a pet had a larger effect than a standard blood pressure medication. One of the biggest influence on the blood pressure is diet. There's been a lot of debate around salt in recent years. The research is very clear for people with high blood pressure. If you want to improve your number naturally, sodium intake should be kept below about 2 grams per day. Many people assume the main problem is the salt shaker, but rarely that's the case. Only a small portion of sodium comes from salt added at home. About 80% comes from restaurant meals and processed foods. For example, a meal that looks healthy, like a vegetable soup and whole grain bread, can easily contain more sodium than recommended intake for the entire day. Several decades ago, Finland introduced policies that required warning labels on high salt foods and promoted options that were lower in sodium and higher in potassium. Even major fast food chains adapted their recipes. Over time, average sodium intake dropped by about 30% and average systolic blood pressure fell by 10 points. Even more striking, deaths from heart attack and strokes in middle-aged adults declined dramatically and life expectancy increased for both men and women. Another key part of that success was increasing potassium intake. Potassium works in opposition to sodium. While excess sodium tends to stiffen blood vessels, potassium helps to relax them. It also assists the kidneys in removing extra sodium from the body. Diet rich in potassium containing foods such as bananas, oranges, beans, sweet potatoes, and leafy greens have been shown to reduce blood pressure by 5 to 7 points. That said, this approach isn't appropriate for everyone. People with kidney disease or those taking certain medication need to be cautious and should always speak with their doctors first. Physical activity is another powerful tool. For a long time, aerobic exercise was considered the gold standard for blood pressure control. More recent research suggests that certain strength based approaches may be just as effective or even more so. A large analysis published in 2023 examined hundreds of studies and found that isometric exercises where muscles contract without movement, such as wall sits or planks, produce some of the largest reduction in blood pressure. That's it. The takeaway isn't that everyone needs to do planks. The broader message is that any regular movement helps. Cardio, resistance training, light activity, it all contributes. The best exercise is the one that you will actually stick with. When people improve their diet and become more active, weight loss often follows, and that's another important factor. On average, losing about 1 kilogram or a little over 2 pounds is associated with 1 point drop in blood pressure. Even a modest weight loss can make a meaningful difference. Alcohol is another area that often surprises people. While it may feel relaxing in the moment, regular intake, especially more than 2 drinks per day, tends to raise blood pressure over time. Smoking has a clear and a harmful effect as well. Nicotine causes an immediate rise, and long term smoking damages the inner lining of the blood vessels, making them stiffer and less flexible. Sleep plays a larger role than many people realize. Consistently sleeping fewer than 6 hours per night increases the risk of developing high blood pressure. Some people sleep long hours but still wake up exhausted, which can be a sign of obstructive sleep apnea, a condition where breathing repeatedly stops and starts during sleep. This is one of the most common causes of blood pressure that's difficult to control. Loud snoring, choking sounds at night, or persistent daytime fatigue are all reasons to discuss sleep testing with a doctor. Now, stress is one of the most complicated things. Short-term stress can temporarily raise blood pressure, but long-term stress affects people differently. Often, the bigger issue is how stress is handled through poor eating habits, excess alcohol, or smoking. Finding healthier ways to manage stress can indirectly improve blood pressure. So, what should your target blood pressure actually be? Large studies like the SPRINT trial compared different treatment goals and found that aiming for lower numbers significantly reduced the risk of heart attacks, stroke, and early deaths. While aggressive treatment can come with side effects for some people, this research led many guidelines to lower the threshold for diagnosing high blood pressure to 130 over 80. The purpose of this video isn't to overwhelm you. You don't need to change everything at once. Long-term success comes from small, sustainable steps. I encourage you to choose just one strategy from today's video and start there. It's a powerful way to stay accountable, so don't forget to leave a comment below. Even with excellent lifestyle habits, some people still need medication, and that's okay. Medication can be life saving. If you found this information helpful, consider it sharing with someone who might benefit. And that's all for this video. I hope you like it. If you did, give it a thumbs up, share it with your friends and family. And if in case you haven't subscribed to my channel yet for such science-packed content, then please subscribe to my channel. Don't just watch and go. I want to see you again. See you in the next video.